Hi guys, Dr. Flynn here, or Dr. Shaun, however you know me. So today we're going to be talking about morning breath. We're going to be talking about some of the causes and some of the remedies. Most people experience morning breath at some point, so this is a pretty good lecture for everybody. Now, what causes morning breath? There are a number of different causes of morning breath, but the two biggest causes are dry mouth and bad oral hygiene. Now, dry mouth. Dry mouth, I would say, is probably the most common cause. So saliva is responsible for removing the bacteria that can cause bad breath. So when we sleep, saliva production decreases. Basically, as saliva production decreases, then your mouth becomes dry, and that dry mouth can cause your bad morning breath. Now, also, there's certain medications that can cause dry mouth, so that's very important, especially for your patients, especially older patients that take a lot of medications. If any of those medications cause dry mouth, that can be some of the root of their cause of any kind of morning bad breath. Now, the second common cause is poor oral hygiene. So basically, if the patient's not brushing or flossing effectively, bacteria can start to invade in the areas of the mouth. But morning breath can be a symptom of periodontal disease, which affects the periodontium in terms of causing bad breath. So make sure that your patients are really taking care of their oral hygiene. Now, other causes would be if you eat certain foods. Certain foods have strong smelling qualities like garlic and onions that can cause bad morning breath the next day. Another cause is tobacco. So tobacco use is directly linked to morning breath and also the general halitosis. It can dry out your mouth and make you more prone to gum disease. Not to mention, if you add the smell of the smoke itself on top of that, your breath's gonna stink. And one of the other reasons would be GERD, also known as gastrointestinal reflux, also known as acid reflux. So stomach acid can go up into the esophagus, which can in turn cause that bad breath smell. Now, how do we treat morning breath? The most common remedy is better oral hygiene. Brushing, flossing, even mouth rinses can help decrease bacteria and in turn treat your bad breath. Now, if you wear a mouth appliance at night, then clean it daily. It can harbor a lot of bacteria, and so that bacteria can cause that bad breath. And if you're smoking or using tobacco, then obviously stop, and that would basically be your only solution to stop bad breath due to tobacco. Also, what I recommend for some of my patients is sugar-free gum. Sugar-free gum can also be helpful in treating some morning bad breath that kind of even goes on after you brush your teeth and kind of goes through the morning. Sugar-free gum for about like 5-10 minutes would be helpful. Besides of making our breath naturally smell good, it can also help to stimulate the flow of saliva and freshen your breath simultaneously. Now, if you're bad breath due to period disease, then your dentist will have to treat you with more of like a scaling or root planings, more like deep cleanings to help kind of get rid of that period disease. Now, for those that are experiencing bad breath as a result of GERD, or acid reflux, your doctor can prescribe actually acid-reducing medication that you can take at night before bed. Okay, so that's very important. And last but not least, in order to just prevent morning breath in general, drink lots of water before bed, avoid strong-smelling foods before bed, and obviously avoid tobacco. It is very important to have good oral hygiene to treat and prevent morning breath. If you follow these preventions and you still have morning breath, then you can contact your dentist so they can determine the cause and recommend treatment. Okay? Well, I'm Dr. Shaun. That was my lecture today. Let us know if you have any questions. Bye, guys.